Welcome to your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to preparing lasting solutions. I am your regular anchor, Oshuomowa Daniels. Our focus this week is on reactions trailing the suspension of the safe abortion guidelines by the Lagos State government. But first is the news segment.
One passenger, big aunty. Come and enter my bus now.
Hey, conductor, this cough is serious. I beg, you need to go to the hospital.
Hospital? Aunty, if I go hospital now with this cough, those people will just say I have COVID-19.
No, they won't. Doctors say cough symptoms are different in every condition. Some are dry, others are wet, like your own.
God bless you, aunty. I have told this my conductor. The cough has refused to go, and it could be tuberculosis.
Conductor, check am o. Make you dey sure, because who no go, no go, no.
Check that cough for tuberculosis.
Check am o, make you dey sure.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
To support the objective of the World Health Organization in preventing, detecting and response to public health threats associated with unsafe foods, players in the food supply value chain have been advised to imbibe Codex Standards practice, which is World Food Standards guidelines. Some food experts who gave this charge at a workshop in Lagos said the global report of 600 million people, that is 1 in every 10 person, falling ill after eating contaminated food, can be changed.
As we all know, food standard, food safety is so dear to FAO's heart, and we would like also to take you through the process where we all arrive at the mandate of FAO being zero hunger and making sure that everything that we consume is of safety, is of safe, good quality, and wholesome for human consumption. I'm representing the lead technical officer, Dr. Blaise Ouattara, who is not currently with us here because he has to attend to another assignment. I will encourage each and every one of you to pay attention. It's not only what we are here to say, but collectively with your ideas, we'll be able to improve the current standard of food that we consume in Nigeria and all over the world.
Now we have to put our hands on deck collectively to ensure that we produce safer foods for secure living and improved health. We have been banned from exporting agricultural products from 2007 to 2016. And we are told that we lost 36.7 billion naira from our agricultural trade, which translates to the fact that Nigeria, while other countries are able to bring up people from the poverty up into the standard living, Nigeria has sunk 100 million people down into the poverty.
Mortality is on the increase. These days we hear of cancer, kidney problems, liver failure, and the rest. But you've just opened my inquisitive nature with all I have heard here, that very soon there will be a reduction in all these diseases caused by poor handling of food. And once again,
access to sufficient amount of safe and nutritious food, according to the experts, is key to sustaining lives, promoting good health among the generality of the population, and also supports national economies. The ECOWAS regional workshop to create awareness on the importance of coded standards and codes of practice in Nigeria was organized by the Food and Agriculture Organization of the United Nations, FAO, in collaboration with Standards Organization of Nigeria, SON.
And the number one is to create awareness on codex activities at local, state, and regional level, to train journalists on codex matters in national, regional, and international level on how to report on codex activity. Next slide, please. To improve the technical capacity of farmers, processors, SME on codex activities. And finally, to distribute National Codex Committee information, education, and communication materials.
We are committed to manufacture good and quality food in Nigeria to make sure that we safeguard the health of our nation, as we all say. So on behalf of AIBT, I want to say thank you to the organizers and thank you to all the participants. And I implore every one of us to participate fully and to contribute in our own little way to make this workshop fruitful and worthwhile.
The Codex Almateros is a collection of internationally recognized standards code of practice, guidelines, and other recommendations published by the Food and Agriculture Organization relating to food production and food safety.
Officials of the National Agency for the Prohibition of Trafficking in Persons, NAPTIP, have rescued a 12-year-old girl who was allegedly forced into marriage with a much older man. The supposed 50-year-old man hails from the Adaka area of Makurdi, Benue State, according to the organization, and intended to take the 12-year-old girl as his third wife. The girl, who was told by her family that she was being taken to another family where she would live and attend school from, did not know she was being married up to the head of that family as his third wife. Gloria Bai, NAPTIP commander in Makurdi Zone, said investigations revealed the girl had been in the forced marriage for about 3 months and the man had been abusing her. She added that arrangements are in place to find and arrest the man, as he had fled his home by the time the officials arrived. The Director General, National Agency for Food and Drug Administration and Control, NAFDAC, Professor Mojisola Adeyeye, has said Nigerian pharmaceutical companies must be ready to trade their products across the continent by providing quality products that can be approved in different countries through continental reliance among regulators. Adeyeye said this will encourage research and clinical trials of new molecules, immune modulators, complementary alternative medicines, especially for some non-communicable diseases such as cancer, diabetes, among others. She pointed out that innovations were introduced by the COVID-19 pandemic, which has taught us in Nigeria to embrace the manufacturing of vaccines and active pharmaceutical ingredients, stressing that until Nigeria has at least 5 companies producing pharmaceutical ingredients and 1 or 2 companies manufacturing vaccines, Nigeria will remain insecure. The World Health Organization, WHO, said 35 countries in 5 regions of the world have now reported more than 1,010 probable cases of unexplained severe acute hepatitis or liver inflammation in youngsters. According to the United Nations Health Agency, the number of the cases reported is increasing since the outbreak was first detected on April 5th. The agency added that it is keeping an eye on the puzzling spread of hepatitis in previously healthy children, which has left dozens needing life-saving liver transplants, in addition to tackling COVID-19 and the monkeypox outbreak. To promote better understanding of where the outbreak is happening, WHO has launched a global online survey, which will also help to compare current cases with data from the last 5 years. The World Health Organization Director General Tedros Ghebreyesus has declared monkeypox a global health emergency. He said the virus has caused 5 fatalities, spreading to about 75 countries. The WHO chief added that assessment of monkeypox is moderate globally and in all regions except in the European Union, where the risk is high. Tedros emphasized that the need for a speed up of vaccine development and the implementation of measures to limit the spread of the virus galvanized the decision to declare the emergency.
We are always ready to see how we can contain this by standard protocols that have been put in place already. So that helps us. to be able to do the same for this. They have specialists, they have epidemiologists that are vast in this, and they're spread all over the world. For them to declare it a state of emergency or something of healthcare concern, just take it that that's the way it is. We may, however, not be seeing that kind of figure here in Nigeria for some reasons. Some are known reasons, some may be reasons that we may have to find out later, just like coronavirus as well.
Following a record of over 16,000 cases of monkeypox and its spread to 75 countries across the globe, the World Health Organization declared it a public health emergency. This is coming at a time when the world is still battling with the COVID-19 pandemic, and for this medical personnel, there is an urgent need for more preventive measures.
It's actually more important for you to prevent than to wait for it to attack you and then start for cure. So the fact that we have little coming up now does not mean we should rest on our oars.
Universal precautions is the key, very important, especially healthcare workers. We have cases, even in Lagos here, and we know that for diseases of infectious origin, we have our isolation center at Mainland Hospital, Yaba, where we have isolated cases there. So if we have suspicious or suspect cases, they are usually referred there. You have such cases, you have to be in touch with your local government because it is a disease of immediate notification.
Amidst the prevailing demoralized human resource for health, brain drain, and poor health infrastructure in the country, members of the Medical Association are hopeful that the next political dispensation would raise adequate funds for the sector through appropriate budgetary allocations.
It is, however, pertinent to state that as Nigeria is undergoing a transition process, policymakers in the next dispensation should endeavor to improve health indices of the country by instituting functional, effective, and efficient health system.
Other suggestions made by the professionals to tackle emerging health challenges in Nigeria include providing the political will towards local production of vaccines for COVID-19 virus and other infectious diseases, as well as a review of the 2006 health reform law by the Lagos State government to improve patients' and physicians' health rights.
My friends or maybe outsiders can use me or insult me with the way I am. I can feel depressed.
They face a lot of challenges with their speech, and that occurs because of the nature of the defect. It affects the palate, and the palate is an important portion required for speech.
The birth of a newborn baby usually brings joy into the family. But when any baby comes with a congenital birth defect, like cleft lip or palate, the reverse is often the case.
Different things are attached to the birth of a cleft patient. There have been cases where these children are killed by birth. Some don't live up to 5 years of their lives.
Cleft lip and palate is a congenital abnormality that happens to the mouth of babies during their formative period, with some genetic factors identified as responsible.
Right now, we can't categorically say the exact cause, but we know that there are two factors that affect the cleft lip and palate. One is the genetics, another is the environmental factors. Genetics is such that some genes that run in some families predispose the mothers to having babies with clefts. And environmental factors is that things like smoking, use of folic acid, lack of use of folic acid during pregnancy, also some illnesses can predispose the mother to cleft.
There should actually be a barrier between the mouth and the nose when you open the throat. But as you open it, you see that there is a big gap in cleft palate. So that barrier is not there any longer. So there is direct communication between the mouth and the nose. So when the food goes into the mouth, some of it will be coming out through the nose because there is now an opening going into the nose. There's nothing blocking the food from going into the nose. So that's why some of it will go into the nose, some of it will go down the throat. There's a lot of social stigmatization because some people believe that these children, they are evil.
What we eat, what we drink, then the drugs that the pregnant people take during antenatal causes it, and genetics. If the father or the grandfather have had it, the baby too may have it. The babies that are born under this condition, they are not ogbanje babies. They are not bad babies. They are not babies that brings bad omen to the family.
As we can get help at Lagos University Teaching Hospital, the Cleft clinic there, every Tuesday, and we run a clinic every week, and the treatment is completely free for the mothers.
July is National Cleft Awareness Month, with a focus to prevent the condition and enlighten people about available surgical interventions. The Federal House of Representatives Committee on Health has disclosed plans for legislation to stop medical personnel from leaving the country for greener pastures. The members who made this known during a visit to the Lagos University Teaching Hospital, LUTH, noted that the worsening brain drain has greatly depleted healthcare resources in Nigeria.
These consultants that are leaving what they should do to help their fatherland and run for greener pastures outside Nigeria, those are people that this country spent hugely in their training. Because when you juxtapose what it takes to train and produce a consultant in any field of medicine in Nigeria with what they pay abroad, you see that they are almost being trained free of charge in Nigeria. And the moment they qualify as consultants, they now become very marketable. They now rush out there to pick a new job and start taking care of non-Nigerians who are there. And then their brothers and sisters who contributed in their training will be left in the hands of people that may not be very qualified to do. It's a very, very bad thing. So we are coming up with a legislation, an act of the parliament that will curb that unnecessary and very, very unfriendly movement of our doctors. The CMAC raised the issue of push and pull. If we cannot control the pull, because the pull is from outside, we'll be able to control the push from here through proper legislation.
With what we have seen, it's a very serious issue, what we have said, especially on the brain drain. Especially on the brain drain, it's something that Chairman will really need to take very seriously with the federal government, because if we continue at this level with the brain drain, which means we'll be in high whatsoever challenge.
The House Representative Committee visit to LUTH was to assess the hospital's activities and response to current health challenges.
In 7th October 2021, we commissioned the Dialysis Center, which we took the members to. It was essentially sponsored by the family and also the Lions Club. However, the federal government also committed a large sum of money and appropriated to LUTH for the lift that we saw. Also, as part of our efforts, and we were rewarded in this, during the COVID-19 pandemic, the Airtel gave us a promise that they were going to renovate A block, which we showed you to the tune of about 200 million naira. It was renovated and commissioned November 2021, but as part of our counterpart funding, which was provided in 2021 budget, that the place is 120 beds. So from the appropriation of 2021, we also bought 120 beds and other supporting facilities. I'm also happy to inform us that I think the last time the honorable members came in 2021, we took you there. We also had the benefit of a donation of about $450,000 US, pediatric surgical theater, 2 pediatric surgical theater by Kids OR and Smile Train. They equipped the center and they renovated the center and also equipped too. So in the hospital now, unlike before, where children actually compete with adults for surgical spaces, now and usually when adult and children, when they compete for a space, usually adult that will get the space. But in LUTH, I'm happy to inform us that all the operations that were for children are actually done in that. We are grateful to the donors. The rehabilitation of labor ward and neonatal unit, the honorable members, they are there, and this was funded by the Appropriation Act of 2021. We just got in there 2-3 months, and we're still a work in progress. And the honorable members, I can assure you that some of your observations, we are going to work on them, and we are going to make the place to be better.
The research is capable of improving a country's economic prosperity or a country's profile in the scientific area, and they're also capable of improving even our image when we start to do groundbreaking research that contributes to health security of the world.
Like water is to life, so is research to healthcare delivery in any society. Through research, information about disease trends, risk factors, outcome of treatment or public interventions, and lots more have helped people live longer, healthier lives. This is exactly what NIMA is doing for the nation's health sector and can do more if supported by governments at all levels, corporate organizations, and individuals. Watch NIMA at a glance on Health Affair on AIT. Support research. A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Some women groups have called on the Lagos State government to immediately lift the suspension on the guidelines of safe termination of pregnancy recently adopted in the state. The women who noted that such an act will violate the right of rape survivors to safe abortion care noted that unsafe abortion accounts for a high number of maternal deaths in Nigeria.
The fact that the Roe versus Wade controversy is raging so much now, and the onus is now on a lot of states in the U.S. to decide by themselves what they will allow and not allow regarding abortions, I think emphasizes what we're trying to do here now in Lagos State, giving the power to the state to decide what it's going to allow and not allow. And I think the time is right. And I take the point also that through a lot of peer learning, we should encourage other states to do a lot of that. Then I know Dr. Fabanwo referred to, well, I assume it was Dr. Fabanwo that said it about what would happen to adolescents that got pregnant. And I know because we're working with Hello Lagos, and we've now had to evolve a plan to enroll a lot of young teenage pregnant girls in under the health insurance scheme, just so that when their babies are born, they don't get into a lot of trouble, and then we can try and take care of the baby for the first year. But I mean, there's limited funding for that kind of thing. And before it gets to that stage, a lot of them, I am sure, find other ways to get rid of that pregnancy. And that has led to the loss of a lot of lives and a lot of morbidity within that age group. So I think this is something that we need to really take serious, and I think it's something that the time has come for. The other thing I wanted to also point out is this seems to be one of those things that the significance really will not be felt at the time it happens. I think it's one of those things that we're going to look back on in a lot of years to come and say, wow, see how many lives this has saved. that this was just the right thing to do at that time. So I really thank everyone that has been a part of this. Very many young girls, many of them may not even know that they are pregnant. Even it's also true that married women also terminate pregnancy. So each time we talk about termination of pregnancy, we talk about the adolescents. No, not only that. I had a patient, I think it was 2011 or so, 9, sorry. And that one was very interesting. It was a wife of a pastor that got pregnant. The husband had actually traveled out from the country. And she got pregnant, maybe through like the like the Virgin Mary. So she got pregnant and she went for termination of pregnancy, unsafe termination of pregnancy. At the time she was brought in from following complications of unsafe abortion, she came, was admitted. We did everything humanly possible. We couldn't save her life. She died. She didn't need to die. She didn't need to die if she had gone for safe termination of pregnancy. So when we talk about termination of pregnancy, there's this feeling that it's only single girls, and they know. An unwanted pregnancy, unplanned and unwanted pregnancy will be terminated. I don't know how, but it will be terminated. That's our experience. That we've seen. Any pregnancy that is unplanned and unwanted will be terminated. And I'm happy that it's happening in Lagos. And Lagos is the first state. The opportunity provided for the termination of pregnancy for legal indication should be maximally explored for the benefit of women and the society.
The Lagos State Guideline on Safe Termination of Pregnancy is modeled after the National Guideline for Legal Indications of 2018, prepared by the Federal Ministry of Health to provide guidance to medical practitioners and other stakeholders on when it is lawful and unlawful to abort a pregnancy. On June 29, 2022, the 40-page document was released to the public by the Lagos State Government and suspended on July 8, 2022, following reactions from different quarters. For these women advocates, the denial of safe abortion care to survivors of rape and others who may require such intervention for survival, the suspension violates their rights and privacy.
Abortion is also a fundamental right for women to be able to decide, if it's a bodily integrity issue, it's a right to sexual and reproductive right, which is guaranteed. But to also decide at a point in their life whether they think this is safe or this is not safe for them. So what the guideline is doing is just to direct that decision in a manner that it will be acceptable for every one of us. Physical health, even when his mother's life is not at stake, but the physical health of the mother would be jeopardized if the performance of the operation is reasonably having regard to circumstances of the case. So what this is telling us is essence is that when the life of the mother is at stake, or the physical health of the mother, then the mother can go through an abortion. And the abortion, when it's lawfully done, it is okay. So who determines when it is lawfully done? The medical practitioner knows the cases, they know the cases, it's not new to them. So what the documents did was they're not bringing in any extraneous thing into the documents. They are not expanding the law. They are not bringing anything new into the law. And also on the medical grounds, they are not bringing anything new into medical issues. They are all the issues that are existing. It's just a compilation of all these issues that are in the document, so that it can be standardized across board. And also for new medical practitioners coming into on board will know the cases in which pregnancy can be terminated. So, what are the legal indications? And we can have as many as possible. When a woman has cancer, and probably she wants to go through, what cancer is? She wants to go through chemotherapy,
radiotherapy, even without a baby in her. If a woman is going through chemotherapy or radiotherapy, we know what happens. A woman has to be treated. Or she's in stage 4 cancer. What happens? The woman under the right, because she's faced with, if the pregnancy continues in this case, the life of the mother may go with it. Or it may affect the physical health. Then what we are saying is that the woman can actually procure an abortion.
The Lagos State Guidelines on Safe Termination of Pregnancy for Legal Indications defines therapeutic abortion as the termination of a pregnancy when it endangers the mother's life, physical or mental health, or when the fetus has a condition incompatible with normal life.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and advert placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
I have got my car for full body work.
Madam, look, we will shine this car.
Wait. This cough doesn't sound good at all. What are you doing about it?
Oga doesn't want to go to the hospital so that they won't say he has COVID-19.
No, now. Cough is a sign of different infections, including tuberculosis. You would only know which cough it is if you go for testing.
Kai, I've been coughing for more than 2 weeks now.
There's no need to fear. I have done this test myself. To know the right treatment for the particular cough you have, you must first get tested.
Oga Chekamo, make you dey sure. Because
who no go?
No go, no.
Check that cough for tuberculosis.
If your cough is more than 2 weeks, it could be tuberculosis. TB tests and TB treatment are free. Just call the National TB Hotline on 3340 for information on where to get the test. This message is brought to you by the Federal Ministry of Health with support from the American people.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
It's a common saying that you are what you eat. This is why we make it a point of duty to give you information about food items, fruits, and their nutritional value to help you make healthy choices on our nutrition segment every week. We welcome adverts from food and beverage manufacturing companies on this segment.
Lemon is a citrus fruit that consists of 88 to 89% of water and about 10% of carbohydrates. According to nutrition experts, each lemon contains about 15 to 20 calories and is juiced about 5 to 6% citric acid. Because lemon is very high in vitamin C, an essential vitamin and antioxidant, it is vital for the prevention and cure of many diseases through boosting of the immune system. Lemon can be taken in different ways, but lemon in hot water has been particularly identified by some nutrition experts as very good for sore throat as an antibacterial. No wonder lemon has become very expensive and in high demand within the Nigerian market, with one selling for as high as 100 naira since the outbreak of the COVID-19 pandemic. Please come with me to our clinical segment for tips on healthy living.
Watch what you eat, learn to walk, get some movement going, sleep enough, one waka at a time. Most people don't know this though, but walking is one of the best kept secrets in the world. Walking has humongous benefits, including limited to the following. It helps us maintain healthy weight, helps us keep away unwanted fats, helps us keep away a couple of cardiovascular diseases, heart issues, helps us keep away from diabetes, from arthritis, and boosts our mind and our mood. So talk about mental health issues, walking is there for you. And for those who are living with glaucoma like I am, which has no cure right now known to man, Walking helps you maintain the eye pressure. Most people don't know this.
On our perception segment, we value your opinion on how to improve human lives and the nation's infrastructure.
Those behind the drug chain, what they do is to mount pressure on our children. And so we also said to ourselves, as we are mounting pressure on them to take, we will now continue to mount pressure to don't take. So the slogan of today is that don't take. Because if you take, the temptation to touch will be there. From touching, then the temptation to feel it will be there. And then from there, it might be a journey of no return. Many destinies have been derailed and destroyed.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please join us same time next week for another interesting edition of the program. My name is Oshomowa Daniels. Goodbye for now.